So let's start off and talk about what allergies are in the first place. Allergies are a hypersensitivity or overactive immune system response to substances that are usually harmless. These substances are called allergens, and they can enter the body by eating them, touching them, or breathing them in. Now, not all allergies fall as neat and tidily into these categories, but most allergies in dogs and cats can be put into three categories: food allergies, flea allergies, and environmental allergies. Now, allergies are a progressive disease which gets worse over time. Often it starts off more mild when an animal is young and will progress to have either longer times of year that they are showing signs of allergies, or they'll show more severe signs of allergies as they get older. And that's partially because it disrupts what we call the skin barrier, the skin's innate ability to protect itself against external negative stimuli and infections. Other words that we use to describe allergies are atopic dermatitis in dogs, or feline atopic skin syndrome, if their only manifestation of allergies is in their skin, or because cats in particular have more signs of other types of allergies, feline atopic syndrome, if, for example, they have asthma or GI upset as part of their allergy. So what will we talk about? We're going to start with going over what are the signs of allergies in dogs and cats. Then we'll talk about how we diagnose allergies for them. Then we'll move into specific categories, starting with flea, then food, then environmental allergies. So what signs do we see that tell us a dog might be allergic? The biggest one is itch. Now, classically, we think of itch as that scratching behavior, using like their back foot to scratch at their sides or their neck, sort of like we see with the golden retriever puppy picture in the middle. But because they don't have hands and they can't tell us what they're feeling, other things that they do can be signs of itchiness that can include biting at any part of their body, including their sides or their feet, chewing, licking like we see that bulldog doing at the bottom, largely focused on the feet, rubbing their body up against things, or if their ears are itchy, shaking their heads. Now, classically, itch is considered the first sign of allergies, so we should notice a little uptick in itch before they develop any other skin lesions. But not all dogs show their allergies in the same way. Some are going to be mildly itchy, some are going to be severely itchy, and they can go on to develop other things like redness of the skin, commonly in areas around their eyes, their mouth, their armpits, their groin, and their feet. They're also going to be prone to secondary skin and ear infections. So things like hot spots where they get a patch of hair loss that often is like moist or wet and is really itchy or even painful. Yeast infections, bacterial infections, or mite infections. Now, for most of these, especially the yeast and the bacteria, we say the word infection when we talk about them, but they're not something that the dog is catching from elsewhere. All animals, humans included, have their own yeast and bacteria that are in normal, healthy amounts on our skin. It's actually important for our skin to have normal, low-level amounts of healthy yeast and bacteria. But that skin barrier, that body's ability to protect itself, is disrupted with allergies, and then yeast and bacteria take advantage of that situation and overpopulate, which can make them even itchier. So while we say the word infection, again, it's not catching it from somewhere, it's their own normal yeast and bacteria that have taken advantage and grown out of control. We have a condition called interdigital furunculosis, which is swelling and bumps that form between the toes, either on the top or the bottom of the feet, and often develop these draining tracts, so like bloody discharge. We have anal sac or gland inflammation, which can lead to a dog scooting, licking their behind, or having smelly discharge from their anal sacs. And it's less common in dogs than in people, but dogs can develop hives, sneezing, or eye discharge as a form of their allergies. And over time, this chronic inflammation and or infection associated with the allergies can lead to thickening or darkening of the skin. Cats are going to be a little bit more variable than dogs. They kind of do things on their own pace. So we divide them into 4 common patterns, and a cat might have multiple of these patterns or not fall neat and tidy into a box because they are a cat. But we have self-inflicted hair loss, and that's going to be where the cat licks, bites, or pulls out their own hair, most commonly on their stomach or legs. You can see in that kind of middle upper picture, the cat has been licking his back legs, and actually it looks exactly the same on the other side of his body, where he can reach them. We don't always see scratching as part of this. We might, but for cats, licking is going to be a big manifestation of itchiness. And we don't always see it. Sometimes we question if the hair is falling out spontaneously on its own, or if the cat is doing it. And that's because cats are very secretive animals. They might feel uncomfortable with their itch and do it where their family cannot see them. We call those cats closet lickers. Then we have a condition where they're itchy predominantly on their head and their neck. Another called miliary dermatitis, which you can see in the picture of our seal point on the bottom middle, who has little bumps above his eye. And those are going to be little bumps and little crusts. It's named after millet or bird seed. And then in the picture on the far side of the cat's stomach with that red patch, we have something called eosinophilic granuloma complex. And that is where we get large numbers of a specific type of white blood cell swarm to an area, which can make it a lot itchier. And that's going to commonly be either red, raised, but flat lesions on their stomach, or it can be bumps, and it can affect other places of their body, like their legs or their mouth. How do we diagnose allergies? Well, unfortunately, there is no perfect test for diagnosing allergies. So we have to rely on a combination of their history and physical exam. So if you come here to see us at the U, you're going to get this client questionnaire form, which has a lot of questions, which allow us to get a better idea about what you have experienced at home with your animal. That's going to include things like age of onset. Now, normally we see allergies, I'm going to dab my nose here because it is allergy season. We can see allergies usually start off somewhere between 1 and 3 years of age. Now, allergies can develop in any animal at any age, but maybe their first signs, maybe our mild first indication, like our first infection, happens between 1 and 3. Next, it's useful to know if the signs are seasonal, like right now in springtime with tree pollens blooming, or if they are year-round, or if there's even variation where it is year-round, but it gets worse at certain times, like spring. And then response to treatment. Have you tried any medications for this before? And have they helped, not done anything, or even made the situation worse? Then we're going to do a physical exam. And the goal of this is to look for potential causes of itch and or infections, because infections themselves can be itchy. Now, all infections are going to be due to an underlying condition, but that condition is not always going to be allergies. Sometimes it's parasites. Sometimes it's systemic illness. If the animal is ill, their immune system can't keep that yeast and bacteria in check. So we might talk about doing things like looking at their white blood cells, red blood cells, liver, and kidney, make sure everything's functioning well, and potentially investigate for hormone imbalances. So things like too much stress hormone in their body or too little thyroid hormone, the hormone that's responsible for controlling your metabolism. And if we rule out, so can't find other causes of itch or infection, and their history is saying, wow, this seems like an animal with allergies, we're going to start investigating triggers for their allergies, bearing in mind that they're not mutually exclusive. So we talked about flea, food, and environmental allergies, and an unlucky animal can have all three. So we'll start with flea allergies because that is the one that we can control. What this is it is allergens to the saliva of fleas themselves. So they are allergic to the saliva of the flea. And that's going to cause itching, bumps, and crusts, normally on their lower back, their tail, and their hind legs. Those are areas that the fleas like to live in. Because this is an allergy to fleas and the flea bite, it's not the same as a flea infestation. So it's not always associated with increased or even visible amounts of fleas. It is going to be most common in the late summer and fall. That's when fleas are most active. But especially up here in northern temperate regions, fleas are becoming increasingly adapted to living inside, so it can be year-round. When we look at an animal, we're going to do a careful physical exam and look for things like flea dirt. Now you can see that in the picture of the comb on that sheet of paper towel. And what that was, it looked like dirt, but when we put it on a wet paper towel, it actually dissolves into blood because that is the feces of the fleas, so just digested blood. How do we treat for fleas? We recommend year-round flea prevention with a product that treats adult fleas. Not all flea and tick products are created equal, so we want to pick one that treats the adults, which are the ones that are biting them and causing the allergy. And we're also going to recommend treating other animals in the household so that they are not bringing the fleas in or being a nice home for the fleas that then go and bite our animal who has a flea allergy. And I usually assume that if an animal has an allergy, they're also going to have a flea allergy, and that is the last thing we need on top of everything else they have going on. The next category is food allergies, and this is an immune system mediated reaction or hypersensitivity to allergens within food. Usually these allergens are the protein source, so things like beef, dairy, pork, chicken, or fish. And depending on the study, there's a large range of how many animals have food allergies. It can go from anywhere from 9 to 50% of animals with year-round allergies, but most commonly comes out to about 20%. But while it can occur on its own, it is rare for food to be the only thing that they are allergic to. More commonly, we see a combination of food allergies and environmental allergies. But if an animal has year-round allergies, year-round signs of them, I am going to consider whether food plays a role. It's uncommon for dogs with food allergies or cats with food allergies to have seasonal variation, but for example, if a dog stops at Dairy Queen during the summer and that's the only time that they get dairy, we might see that it gets worse in the summer. Sometimes we also have gastrointestinal signs like vomiting, diarrhea, poor stool quality, or frequent stool quality, even up to 7 times per day. or flatulence. Now, there are some animals who have gastrointestinal signs that respond to diet, but no skin manifestations, and those are kind of a gray area we call inflammatory bowel disease. And there are dogs with food allergies that have no gastrointestinal signs. But if a dog has classic signs of allergies, or a cat has classic signs of allergies, and they have vomiting, diarrhea, or trouble with their stool, I'm going to really strongly consider, could this be a food allergy that would explain both categories? Additionally, if they are relatively young when they first start showing signs of allergies, so under a year of age, or older, like over 5 years of age, I'm also going to be suspicious that they might have food allergies over environmental allergies. So how do we diagnose food allergies? The only reliable test is an elimination diet trial. Things like blood tests, patch tests, saliva tests, or hair tests are not reliable for diagnosing food allergies. So what we do is we feed an amino acid or hydrolyzed protein diet. What this is, it actually uses the same technology that is made for babies, infants who are allergic to dairy and therefore, or milk proteins, that then have to have hydrolyzed protein sources where the protein is broken down to bits that their body can use for protein, but does not recognize where it came from. So they're getting the protein, but not recognizing if it's something like beef, soy, or chicken. Alternatively, we'll do a novel protein diet. This is going to be more common for cats. I prefer personally doing the amino acid or hydrolyzed protein diets. But if the dog or cat does not agree that that diet is tasty enough to eat, then we might have to do a novel protein diet. And what that is it's going to be a new protein source that this animal has never encountered before. Things like rabbit, kangaroo, or alligator. Now, if it's was once an outdoor cat, rabbit might not be novel. So we have to make a whole list of everything that they might have eaten before to identify a truly novel protein. Then we strictly feed only that food for at least 8 to 12 weeks. Now, at the 8-week mark, we've captured about 90 to 95% of dogs and cats with food allergy, but we'll often push it out for that 3-month period to try to capture as close to 100% as possible. During that time, they can only get that special food. And I have prescription diet on here because over-the-counter diets will often contain trace amounts of other protein sources. Very similar to how when you get a granola bar, if you look on the back, it might say made in a factory that processes peanuts. That's because no peanuts go into making that specific granola bar, but the factory processes peanuts, so there might be peanut particles in that granola bar. The same thing happens with over-the-counter foods. So the prescription diet ones are made in factories where that's all they do on those days or in that entire factory. They make sure that there are no even traces of other protein sources that aren't supposed to be there. And they can't get treats. They can't get flavored medications, and that's going to include often the oral flea, tick, and heartworm preventions, as well as gelatin capsules. They can't get supplements like joint supplements or omega-3 fatty acids. They shouldn't lick their housemate's bowl, or this is gross, but eat their feces. Nothing with any flavoring other than that food should cross the animal's lips. It is a really hard 8 to 12 weeks. I've had to do it myself. And I want to make sure that when we do it, it's very, very strict so that we can look back and say that it either worked or it didn't. Not, oh no, they kept accidentally eating their housemate's food. Could that have been enough to trigger their allergy? Now, during the beginning of the trial, I'll often do symptomatic medications to make them comfortable. The goal of this is it's going to take a while for that food to start working, and we don't need to make them wait to be comfortable that long. But towards the end of the diet trial, I'm going to try to take those symptomatic medications away to see if they can be comfortable on only the food. If that is the case, we'll say, okay, it really is seeming like they have a food allergy. And we'll move into phase 2 of this, which is challenging their diet with their old food. I want to make sure that the food was what did it, not all the other hard work that you've been doing to keep your pet comfortable in that time. And once we start introducing them to the old food that they might be allergic to, they should flare. So they should get some sign of their allergy come back anywhere from a couple of hours to 2 weeks later. So let's look at an example of this. We have this cat who is a wonderful example. He came in and he had this wound on his neck. And that wound was actually caused by him itching his neck so hard that he was causing that to himself. Now, because he had this wound, when he started the diet trial, he did also start on a medicated ointment that contained a topical steroid to decrease inflammation and a topical antibiotic to treat infection. When he came back for a 4-week recheck in that middle picture, it looked really good. So he was able to stop that ointment and continue on only the food. When he came in for his 8-week recheck, it looked really good, and he'd been able to be on just the food for about 4 weeks. So he moved into phase 2. He went back to his old food, and within those 2 weeks, he did start itching his neck again. And we don't wait for it to get bad. So the minute that he started itching again, and we had that confirmation, said, okay, go back to your special food. You do have a food allergy. So how do we treat food allergies? They can be managed, but not cured, just like all allergies. The mainstay of treatment is avoiding food allergen triggers. So that can be done a number of ways. We can either continue to feed them that amino acid hydrolyzed or novel protein diet that we used for their trial that we know they tolerate really well. And these diets are typically formulated so that they are safe and healthy for an animal to eat long term. They meet everything that they need. They just happen to be special where the protein source is new or broken down. Alternatively, we can do single ingredient challenges to identify food triggers. What that's going to look like is about every 2 weeks, we would introduce a new protein source until we've identified what they are allergic to. And then we can know, can we go on a limited ingredient diet that just doesn't contain their specific allergens? Now, sublingual immunotherapy is not commonly used for food allergies in veterinary medicine, but is pretty common for humans who have food allergies. We would only really move into doing this if for some reason there is a food allergen that simply cannot be avoided. And what that's going to look like is drops that include extracts of what they are allergic to in the food that goes under their tongue or into their cheek pouch, that side of their mouth. And the goal of that is to increase their tolerance to the allergy. The allergen. So then when they experience it, they need more of it to cause a reaction and hopefully actually not experience a reaction. Environmental allergies is going to be our most common kind of allergies in dogs and cats. And that's going to be the immune system overreacting to things in the environment. We can have year-round environmental triggers. That's going to include things like house dust mites, which are microscopic little mites that are present in like rugs, cloth, really everywhere. They're going to live largely off of skin cells, and you could drive yourself crazy vacuuming every minute of every day, get rid of everything cloth in your house, and they would still be there. Additionally, storage mites are going to be very closely related to house dust mites, but they're going to be microscopic little mites that live in dry food and cereal grains. Now, it's not a problem with how the food is made or stored. Like house dust mites, they are a fact of life around us, but for an animal who is allergic to them, it sets off their immune system reaction. Dogs and cats can be allergic to other animals. Dogs can be allergic to cats. They can be allergic to humans and birds even. And that, if they're around them all of the time, can serve as a year-round trigger for allergies. Additionally, we have seasonal allergies. So that's going to be where that history of knowing, do their signs of allergies happen exactly the same all year round versus are there seasonal peaks in their signs of allergies are going to be very important. We have mold spores, and this is not the same as having like problems with mold in your house. We have a large number of species of mold that live as part of the world around us. And they're going to be more common when it's wet out in things like leaf piles, but they have a long season. Pretty much the only time that mold spores are not around are when it's frozen solid outside. Then we have tree pollens. And I have this wonderful graph from the Minnesota Department of Health here. And we have the tree pollens in blue. This is the time of year for tree pollens. They're going to usually have large peaks in the early spring from like April to June. Then we have grass pollens, and those are harder to see because they're in gray, but they are going to have a longer season, but fewer high peaks. And finally, we have weed pollens. Those are going to be in the green, and you can see that depending on the species of weed, we have a large range, usually late summer, early fall, with some major peaks, usually looking at our ragweed season in August through September. Additionally, we do have allergies to insects seen in our dogs and cats. Those are usually going to be things like mosquitoes or bees. And of those, they're going to be associated with when the insect bites them or stings them, whereas our pollens are not necessarily going to be associated with obvious exposure, not necessarily that they go outside and come back in, because inside this room, inside of a building, I know if I'm exposed to tree pollens because they come inside. And even if you have a bare lot for a yard, your animal will also be exposed to pollens because they can travel 50 to 100 miles. How do we diagnose environmental allergies? Well, it's going to be a combination of history, examination, and ruling out other causes. So if they have a great history of, in the summer, even more so in the fall, they experience signs of allergies, well, that makes sense. They have an environmental allergy. Whereas if they have year-round signs of allergies, we might talk about doing an elimination diet trial to look for food allergies first before we move on to diagnosing them with environmental allergies. But that's how we diagnose them. We combine their history, their physical exam, and rule out other causes. Allergen testing exists and is very useful, but we don't use it to diagnose allergies in the first place. Rather, it supports their diagnosis and helps us identify what they are allergic to. And there's two ways that we do this. The first is what's called an intradermal skin test, and that's what's shown in the pictures here. In the top picture, we have one of our technicians administering the injections. And what these injections are they go into the skin And they are allergens that are common in our region. So things like birch trees, ragweeds, house dust. And they're going to inject them, and about 15 minutes later, we're going to measure their reactions. And what we're looking for is in the bottom picture. This is a great example of it. We're looking for these big red welts, essentially hives, develop in the skin because they've been exposed to what they are allergic to. So we can see their skin react in front of our eyes. Now, there are a couple drawbacks of this. So even though it's our preferred test, it does require sedation because even a really good dog or cat, it will not hold still for 60 shots in a row. Additionally, it's affected by many medications, including those commonly used to help manage the symptoms of their allergies, as well as stress. So we do also have a serum allergen test. And what that does is it measures markers in the blood for the allergies. So it helps us identify it by circulating markers in their blood. While it's not our preferred test, we don't see the skin react in front of our eyes. There are some uses, particularly if an animal is not safe to sedate. This does not require sedation. Additionally, if an animal is reliant on a medication to be comfortable that will interfere with a skin test, the serum allergen test is less affected by medications or stress. So how do we treat environmental allergies? Again, like all allergies, it can be managed, but not cured. There's three pillars of what we think about when managing environmental allergies. The first is treating and preventing secondary infections. The second is improving the skin barrier. And the third, the core of our treatment, is decreasing itch and the abnormal immune system reaction that is the allergy. So to treat and prevent secondary infections, we'll often use topical antiseptics, antibiotics, or antifungals. The goal of this is, especially for an animal who is really prone to these secondary infections, we want to try to minimize the amount of systemic, so oral or injectable antibiotics or antifungals that their body has to be exposed to. We also want to improve the skin barrier, so make the skin more resilient to allergens and secondary infection. And that can look like a number of things, including various shampoos, mousses, lotions, and oral supplementations. Even things like wiping off an animal's paws when they come in from outside can help to mechanically remove those allergens so that they're not sitting on the skin. Then we have things to decrease that allergic response in the first place. The first of which is allergen avoidance. So for things like food allergies and flea allergies, that might be able to be obtained. But for things like environmental allergies, like I mentioned, even if you stay inside, you are exposed to pollens, and pollens will travel 50 to 100 miles. It's not realistic to be able to avoid most environmental allergens. So from there, we have symptomatic treatment and allergen immunotherapy. Symptomatic treatment is going to be using medications to decrease the signs of the allergies. I'll liken it to right now is birch tree season, and I am going to need to take my Zyrtec. And the Zyrtec helps me feel comfortable and be able to go about my day. But the Zyrtec is not treating my allergies, just the signs of them. So I know that when my Zyrtec runs out, I start to get a runny nose, have itchy eyes, so I'm going to need to take my Zyrtec again. It's helping me get through this season, but it's not curing my allergy. Alternatively, and often in addition, we have allergen immunotherapy. And I'm going to talk more about both of these just now. So the goal of symptomatic medication is to find the safest but most effective medication that gives a satisfactory quality of life, both to the animal and their family. And we have a variety of different medications, and it's not going to be a one-size-fits-all plan for every animal. It's going to rely on how bad are their allergies, what is their individual immune system like, and what other diseases might they be facing. So we will often use one or a combination of medications, including antihistamines, things like Benadryl, Zyrtec, or chlorpheniramine. Cytopoint, which is a long-acting injection that targets the molecule that helps to send the itch signal from the skin to the nerves. Unfortunately, it is only useful for dogs and will cause allergic reactions in cats. Hopefully they come out with a long-acting injectable like that for cats in the near future. But like with everything, they're a little tricky. We have Apoquil, which is going to be a once to twice daily pill. It's only labeled for dogs, but we do sometimes use it off-label for cats. We have its brand new relative called Zenrelia, which is, again, labeled for dogs. To my knowledge, there's been no publications, and I have not personally used it in a cat yet. Then we have cyclosporin or Atopica, which is approved for both dogs and cats. And then for either when they present and their allergy signs are really severe, or for those for whom other medications do not satisfactorily control their allergies, we can use oral steroids, which have a number of different formulations, including prednisone, prednisolone, or methylprednisolone. Again, it can be a little trial and error to find the exact one or combinations of ones for any individual animal, but our goal is to find out what minimizes side effects, but maximizes the improvement in their quality of life. Additionally, we have allergen immunotherapy, which is also called hyposensitization therapy. Now, this one is the only one that treats the allergies themselves, not just the symptoms of the allergies. So a lot of people think of it as a last-ditch treatment, that we've tried all the symptomatic management and that's not working. But I would encourage people to not think of it that way. It's not a last-ditch treatment because it is the only one that stops the progression of allergies and treats why they're allergic in the first place. Additionally, it might work better if started earlier in the disease process, so with younger animals or more mild forms of allergies. What it's going to be is it's actually just administering what they are allergic to in regular, frequent doses in order to try to decrease the body's reaction when it sees it out in the wild. That can either be injections given at home under the skin, usually once every 3 weeks, sublingual immunotherapy, so drops given underneath the tongue or into the cheek pouch, either 1 to 3 times per day. And since we're retraining an animal's immune system, it's not going to work quickly. It's going to take 6 months to a year to become effective. So we're going to overlap with symptomatic management, at least in that time period. And it's going to have to be given year-round, even for seasonal allergies. So for example, a dog with ragweed allergies, if they're just allergic to ragweed, if their allergies are severe enough in the fall, it might be worth it for them to get year-round injections so that they don't experience such a bad reaction. Alternatively, they might be mild and easily controlled, in which case immunotherapy might not be the right choice for them. It all depends on the animal's signs, duration, and severity. But if it does work, it does have to be continued long-term. And in people, we often can stop after several years, but dogs and cats don't live as long as we do. So once we've done it for several years, usually they're older, we would then address, do we decrease it and risk their allergies returning, which they often do, and we have to increase again, or because it's very safe, the safest treatment, in fact, we have for allergies, do we continue it? Now, this is a picture of Willie, one of our patients. When he came to us, he had this hair loss, redness, and severe itching around his eyes, his neck, his whole stomach had hair loss and thickening of skin because he had chronic overgrowth and infection. It was trial and error for him, educated trial and error, but each immune system is different. But for Willie, we were able to find a combination of topical medications, systemic symptomatic medications, and immunotherapy to give him a much improved quality of life. So to recap, we talked about the signs of allergies in dogs and cats. We talked about how we diagnose them in general. And then we addressed the three most common types of allergies: fleas, food, and environmental allergies. At this point, I'll take questions.
Thank you so much, Dr. Lundberg, for the very thorough presentation. And now we have some pre-submitted questions from guests, and we'll start with those before we get to those that are being submitted in the Q&A. We have a question here relating to all species, cats and dogs. Can allergies affect a pet's gut health? Is there a connection between allergies and IBD?
That is an excellent question. So for food allergies in specific, we have some animals where their only signs of food allergies are skin related. We have others where they have skin and gastrointestinal signs, so that vomiting, diarrhea, poor stool quality. And then we have this murky category that we call inflammatory bowel disease, which may or may not be diet responsive. And we don't classically put that in an allergy category. We classify it as its own thing, diet responsive inflammatory bowel disease, but the diet responsive ones often respond to the same food we use for our allergy testing.
Thanks, appreciate it. This one has to do with the topic of costs. Could you share a ballpark cost for how much allergy testing runs?
Yes, so I can only speak to it here at the veterinary medical center at this point in time. And right now, the cost of testing, the tests themselves, are about $500, both for the skin and the blood testing. Now, we usually do those only if we're looking at starting allergen-specific immunotherapy, which at this point in time is around $360, but that lasts you 5 to 6 months of therapy if you do the injectable, or a bit less for the sublingual.
Thank you. This is on the topic of diet and prevention. Are there daily nutrition choices we can make for dogs and cats to prevent the development of allergies? Does it help to have more variety in their diet? Does it make a difference if they have different kibble types versus raw diets, for example?
Excellent question. So unfortunately, there is nothing that we can do or feed them that will prevent them from getting allergies, especially since there is actually a large genetic component to their propensity to develop it. So I would just recommend feeding a healthy, balanced diet. There doesn't seem to be evidence at this point for dogs and cats that varying their diet much will prevent them from developing food allergies. But we do recommend not feeding them raw diets, that we feed them a complete and balanced cooked diet, on account of raw diets are not helpful with food allergies, despite their advertising, and they are associated with things like salmonella, including for people coming in contact with the feces.
Great. This person is asking about the effectiveness of certain treatments. Does the effectiveness of shots or pills change over time as a pet ages?
That is also a good question. And we do often see allergies get worse over time. So it isn't necessarily that the effectiveness of that first medication wears off, but rather they've either developed a secondary infection, or potentially their allergies, if it's gradually over the course of years, have just progressed to the point where that medication is no longer enough to control it.
Great. This is a more practical question asking about the effectiveness of certain shampoos. If this person says, if we are keeping a dog bathed to reduce allergens, does it always have to be a medicated shampoo like Duoxo?
Yes. So for that one, it does depend on specifically what the manifestation of allergies in your dog or cats, if they let you bathe them, are. We usually do an antiseptic or antifungal shampoo, like I think they're referring to with the Duxo. It is a category. They have a lot of different types of products within that range, but the most common one that we use is an antiseptic shampoo to decrease the yeast and bacterial burden on an animal's skin for ones who are really allergic and really develop these secondary infections. But there are other products that might be better suited for other animals, including ones that are more targeted at improving the skin barrier. Duxo does contain one of those, but there are others. I don't necessarily go off specific brand, but rather try to find the active ingredient that is going to be the right choice for the allergies in this dog or cat.
Sounds good. This is a general question. How can we protect a pet from allergies without impacting its quality of life?
Also, an excellent question. There is no great way to protect a dog or cat from developing allergies. It's going to have a large genetic predisposition. So I'd say give them a good quality of life, feed them a good, complete, and balanced diet, keep them in a normal living condition, give them the best life possible, and that's going to be the best way to improve their quality of life and give them a shot against allergies.
Person following up to that genetic component is wondering, could you share which breeds or mixes may be more prone to certain allergy types?
Yes, so there are a number of breeds that are prone to allergies. Now, any dog or cat of any breed or any mix can develop them, and actually mixed breeds are going to be the ones that we most commonly see. But Labradors, German Shepherds, Boxers, West Highland Terriers, Poodles and Doodles, as well as Abyssinian cats and Siamese cats are going to be some of our more commonly represented breeds. And I would, if you do have an animal that you know their parents, that they came from a breeder, consider reporting if your animal goes on to develop allergies, not because there's anything they might have been able to do, but it's useful information for breeders to have because they might consider changing their breeding program or the animals that they breed to minimize the incidence, since we see certain family lines have higher incidences of allergies.
Thank you. This person is looking for online information that's trustworthy about prevention. Could you share any good, trustworthy online resources for identifying dangerous plants to keep my pet away from?
Yes. So this isn't necessarily going to be specific to allergies. There's a lot of the ways that poisonous plants do not cause allergies, so some can cause contact reactions. And actually, the ASPCA Pet Poison Helpline and the ASPCA website has an excellent list of plants. I myself, every time I go to a garden store and am tempted to bring home a plant for the inside of my house, do pull it up and try to make sure that it's okay that my cats will probably chew on their leaves at least a little.
Good idea. This person is asking about the rates of occurrence of allergies. Are rates of allergies rising in pets in relation to the rate in humans?
So yes, we are seeing a higher incidence of allergies in both humans and pets. And there is a question about why this is happening. Partially, it's probably because we're getting better at recognizing the signs. Additionally, there's some work being done to try to explain what is potentially causing more allergen penetration and development of allergies.
Great, thanks. This is another timing practical question about symptoms. How long should we, a pet owner, let allergy symptoms show or appear before it's time to seek assistance from a veterinarian?
So that's also a great question and will depend on the animal and how bad the sign is. So if it is very mild, like you're asking yourself, even, is it an increase of itch? Um, Maybe you watch for a little bit longer. But at any point, if you are questioning, is this impacting my pet's quality of life? Or are concerned enough? And usually, if you are thinking, am I concerned enough? The answer is yes. I would encourage you to seek veterinary care for them and actually intervening earlier in the disease process. So, when the itch is mild versus waiting for when it's bad is going to allow us to use safer medications and usually less intensive treatment to get them to that good quality of life versus waiting until it's late in the game. So it will depend a little bit on what those are looking like.
Makes sense. Thank you. All right, this one is asking about bathing. Does frequent bathing to reduce itching also remove any beneficial coat oils? And is that a concern?
So yes, we do want to make sure that we're not using an overly stripping shampoo, that we're using something that's hydrating and has things to improve the skin barrier, like ceramides. But a lot of we're often going to be recommending actually frequent bathing. Once weekly bathing is our usual recommendation for our animals with allergies because it helps to mechanically remove the allergens from the surface of their skin, but we're going to be making sure we're doing it with products that will help to support their skin barrier versus just stripping it of its oils. Same as for people, you might use a very drying shampoo that does more harm to your scalp, but if you use the right shampoo and conditioner, most people can shampoo every day without it causing problems.
Great, thank you. Switching topics here a little bit, still on treatments. Are there any natural or homeopathic options for treatment of allergies that seem to work? And what are your opinion on such treatments?
Yes. So part of our goal, like I mentioned, is to use the safest and most effective treatments. So we'll often incorporate things like supplementary essential fatty acids. So there are some good skin support supplements out there. Things like Retinol Ultra or Dermaquin have been shown to improve the skin barrier and decrease itch. But for most of those, they're going to not be effective enough to be our core therapy for animals with more extreme allergies. So might be effective for very mild, but not necessarily moderate to severe. However, I would say allergy shots and immunotherapy is actually the most natural way and considered under the course of like homeopathic definitions is one of the most natural ways to treat allergies because it's just administering what they are allergic to. It's not actually even a medication. So allergy shots are very effective and very natural.
Great, thank you. This one is asking about side effects. What is the current research on Apoquel, and is it connected to any increase in cancer in dogs?
That is a question that we get asked quite a bit. And Apoquel does Google pretty badly. You will find that a lot if you Google Apoquel. Apoquel has been out for over a decade now. So we have almost an entire lifetime data of dogs who have been on Apoquel for pretty much their entire lives. And while increased chance of developing lumps or bumps, benign or not, was reported in the initial field studies and does happen with dogs on Apoquel, there is a large multi-center study that included dogs on Apoquel and the dogs who were the same breeds and ages who weren't on Apoquel to look to see did Apoquel actually increase their risks of developing cancer? And the answer was no. There are certain breeds and ages of dogs who are prone to developing types of cancer. Additionally, inflammation, including inflammation of the skin like allergies, can make an animal more predisposed to developing certain types of cancers, but Apoquel was not linked to it. So I don't worry about it causing cancers. Now, if an animal is diagnosed with cancer, we are going to have a talk about whether Apoquel is the right choice of medication for them. And it comes all back to, is it the side effects, the potential side effects of maybe theoretically, not even proven, making their cancer harder to manage, worth the quality of giving up the quality of life that administering the Apoquel is doing for your animal. So no, long story short, no, I don't worry about development. If your animal has cancer, you would need to talk to your veterinarian about, is this the right choice, or are there other medications that might be more suitable?
Thank you for the thorough answer there. We have a question about long-term use of medication treatments. Can long-term use of steroids or medication be harmful? Are there any long-term side effects that we should be watching over time?
So it does depend on the medication. The specific one mentioned was steroids, which, while they are our most effective at controlling inflammation associated with allergies, they also have some of the highest incidence of side effects. So if an animal has to be controlled on steroids, and there are some where that is the right choice because nothing else makes them comfortable and gives them a good quality of life, then we do routinely check their liver, do follow up to make sure that they're tolerating it well. There are others that are safer, so we don't do checks of blood work and things like that as frequently. But again, it's going to all depend on, is that enough? Because if they're on something safer like Cytopoint and they're miserable, that's not the right choice for them either.
Thank you. Question here. You mentioned stress-related activities or behaviors like deep grooming, which may not be related to allergies, but could be a stress sign. Could you elaborate a little bit more on the difference and what to watch for?
Oh, yes. So cats, I think this question is mostly about cats. Dogs will sometimes lick and chew as signs of allergies. That's going to be more like repetitive behaviors on their legs and paws, not necessarily. It can look slightly different in dogs, but cats can look exactly the same. In that cats will overgroom. We call it psychogenic alopecia when they overgroom as a sign of stress. So part of that history is finding out, do they have any new stressors? Is there anything associated with the development of this licking that could be a sign of stress? It can be hard to differentiate, but a recent study, well, a relatively recent study, looked to find that a lot of cases that we used to call psychogenic alopecia in cats actually respond to allergy medications, which would point to them actually having an allergy cause. So sometimes we'll do a treatment trial with an allergy medication, and if they get better, well, then it was probably the allergy and not stress. But it can be complicated, especially for cats.